Hello friends, I am Dr. Prashant Sharma and you are watching MEDICO'S Hub. This is my second video on demyelinating disease in which I am continuing the comparison between the multiple sclerosis and the Guillain Barre syndrome. Next point I am taking is occurrence. Multiple sclerosis is relatively more common. That is 30 cases per lakh individuals, and it is highly common in North Europe with occurrence of 200 per lakh. Females are affected more commonly than males with ratio 3:1, while the Guillain Barre syndrome is relatively less common, that is 1 to 2 per lakh individuals. Now if sign and symptoms are compared, then multiple sclerosis, if sensory symptoms are involved, then numbness, tingling and altered pain sensation. If visual symptoms are considered, then partial loss of vision as in scotoma, diplopia and optic neuritis, in which optic pain may occur, these may be involved. If motor symptoms are discussed, then fatigueness, muscle weakness, dysarthria, ataxia, dysphagia and intention tremor can be observed. Cognitive symptoms may involve partial loss of memory or decreased attention. Psychological symptoms may also occur, which include depression, euphoria or altered mood swings. In addition, heat tolerance may occur. Heat intolerance may occur. Commonly involved areas are cerebellar tracts, optic nerve, pyramidal tracts, medial longitudinal fasciculi and posterior columns. While here the symptoms, acute phase of symptoms starts with numbness, tingling and altered sensations. initially, if breathing muscles are involved, then it may be life-threatening and may require ventilation support. Symptoms which are appearing initially, these may progress to upper part of body, and after the symptoms are pronounced, then it is followed by a plateau phase that will be discussed in next point. Then clinical progress. There are various types like relapsing, remitting multiple sclerosis, which is most common type. Then secondary progressive multiple sclerosis. Then primary progressive multiple sclerosis and progressive relapsing multiple sclerosis. So these are the various types of clinical progress or the clinical types, in which most common is relapsing remitting multiple sclerosis. In Guillain Barre syndrome, the first phase involved rapid onset, then plateau phase, then recovery is there, which is slow or gradual. Now what is how the diagnosis is made? Sign and symptoms are very important in both demyelinating diseases. Plus imaging, plus laboratory findings. Here again sign and symptoms are there, plus nerve conduction studies, plus CSF examination also plays an important role. And the last one is, what is the prognosis? It is basically a lifelong disease. It means that symptoms will appear, disappear, then appear. Lifespan is reduced by 5 to 10 years. Lifespan is reduced. Quality life suffers. Quality life suffers. Important thing is that 90% individuals will be able to walk even after 10 years of diagnosis. 75% will be able to walk even 50 years after diagnosis, and 40% individuals may reach 7th decade of life. Many individuals may able to walk even after 20 years of diagnosis. So this is possible because of present day medications. Now the prognosis is improved a lot, but in case of Guillain Barre syndrome, first phase is very important. If the patient has survived the first phase, then the chances of recovery are very high. After first phase, 75%, in general we can say that 75% of individuals will fully recover. 20% will recover, but with some permanent weakness or symptoms, and 5% will die. So this is the prognosis of Guillain Barre syndrome. So these are the comparative points of multiple sclerosis and Guillain Barre syndrome. Hit the like button, share and subscribe our channel to get the latest updates and notifications.